Correct. And I always say, take that PTO. Do
Take it.
not bank it. Take it
Prepare the
immediately.
Prepare the others. On today's episode, we have a nurse who doubles as both a legal and nurse executive consultant with more than 15 years of experience. She is well versed and passionate about her roles in healthcare. One of my favorite news anchors. I don't know if she likes to be called a news anchor, but she is one of my favorite nursing news anchors who keeps us in the know of all things nursing, healthcare news, and policy, and how it's going to affect us all around here within the US. Also, we want to make sure that we give her accolades because she has various accolades under her belt, being the 40 under 40 imperative operative,
Yeah.
as well as Excellence in Nursing Education, the Nurse Exemplar Award in Professional Development, and Excellence in Periop Nursing. She is one of my favorite nurses online as of now, and I
Thank
hope
you.
that she is yours. She is known online as the CJN Legal Nurse, Dr. Nwosu, here on the Evolve Nurse podcast. Can we please give her a round of applause for joining us today?
Wow. That's one of the best intros I have ever seen or heard. So that is amazing. I appreciate you. Thank
You're
you.
welcome. I try. Like the people that I have on here, I make sure that I know them thoroughly. Even though I don't know you in person, I do feel like I know you from online. But I
Yeah.
always start off with the question with everyone who comes onto the podcast: did you always see yourself in the role that you are today?
Oh no. No, 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 no. I had an interesting beginning to nursing
Hmm.
as a whole. I honestly didn't even think of nursing as a career at first. I actually wanted to be a physician. But undergraduate school kicked my behind when it came to prerequisites. I'm gonna just put it out there. So uh, I wasn't good at organic chemistry. I really wasn't good in physics.
Hmm.
And so I said, maybe this is not my jam. This is just not for me. So when I graduated with my degree in biology as an undergrad, I actually did other jobs outside of that, and then I kind of went right back into nursing due to my mom and my boyfriend at the time, which who's now my husband. They said you love science, like science,
Yes.
that's you, but you love to help people. And
Hmm.
so they actually encouraged me to actually try nursing school. They was like, well, maybe because I really didn't want to. I said, well, medical school, you got the 4 years, and then you got the internship, and then you got the residency. And I'm like, yeah. And I said,
Actually make
time,
money.
yeah, right. You don't, yeah, you're not making
You're
any
not making
money. You're not making money. And it's like, and that's why my hats go off to all the physicians that actually went
money.
through that journey, because that's insane. And that's a whole different topic in itself. But I thought about all of that and I said, can I really commit that many years to do that? And so I ended up going back to school for nursing um, because of those two people in my life that actually encouraged me. So no, I didn't see myself doing what I'm doing right this second. And it's interesting because, as you know, I'm sure nursing can put you in so many different arenas
Yes.
and you learn so much. And it's interesting enough, I started as an operating room nurse. So, right, and you're an OR nurse. So, like, once you're an OR nurse, you're an OR nurse for life. And it's just, you learn so much
Hmm.
there, and it's always the stigma of you have to do this and that just to get there, and it's like sometimes with the right training, with the right people on your side that's actually rooting for you, you can get it done. So kind of like, I've always been an educator though, which is interesting. I've been an educator ever since high school.
Yeah.
I was always educating people. People always wanted to hear what I had to say, which I found odd a little bit. um, and I think that's really because I keep it human, if that makes sense. It's just, it's not like really cut and dry. I actually know how to put humor into it if it's necessary. I'm a big prankster, I'm a jokester, but then I also know there's a time and place for everything. So I think that humanistic side of me is very interesting to people. And so I've always taught, regardless of what the topic was. And so, as even as I became a nurse and even throughout my nursing career, I've always been an educator.
Mm-hmm.
And so that's kind of like how I kind of rolled into this particular role, especially in the social media space. I just found there's just way too much misinformation. It's just an
Yes,
ungodly amount,
so
and
much.
and who's really hurting at the end of the day, especially for us, is not just our healthcare workers, but our patients.
Mm-hmm.
They're a lot of them are just they're just ignorant, and it's not because they're willfully ignorant. It's because of the stuff that's in their face that's not accurate. So I found that especially after COVID, it was just the amount of backlash that healthcare workers got and the amount of people that died. I think that's kind of like what hit me. Like the it's just on a worldwide scale, but especially in the United States, the amount of preventable deaths that happened. Um, that's really what kind of said, you know what, Cambria, if you're going to have a social media presence, do something positive about it, but actually make it make sense. And for me, that's kind of like how I got into this space. And this lovely space to meet you and nurses like you know. So it's just interesting how nursing kind of gets you in a way where you don't really know where you're navigating towards till you get there. R-
Idea.
Right, right. So, but it's very interesting. Yeah. So, but I've had, like I said, I was an OR nurse. I from the operating room, I actually was recruited out to be a stroke coordinator because again, people think neurosurgery and neurology is the same thing.
They have
They
no
are
idea.
not. They are not. Clinical, it's like if you're not clinical, you wouldn't know that, but it's not. And but it's for me, it was a challenge because it was outside of the operating room. It was a
Mm-hmm.
leadership position, and I actually got to learn what the nurses did on the floor. That was the part that was missing in the beginning of my career. So I actually learned what ER nurses do, what the ICU nurses do, what interventional radiologists do. So it was just a very fast, and I learned so much. So, and then from there, I kind of moved into telemedicine. I actually ran a practice for a few years, a national telemedicine company. So, on the administrative side, actually working with physicians that saw me as their peer, not so
Mm-hmm.
much, oh, you're a nurse. Oh, no, you're my peer. Let's talk and let's get through this. And actually learning how to navigate on the administrative side of how to run a practice. So it's just you just never know. And then like right after that, like while all that is happening, I'm creating a company with my husband, and that's our company, Sun Inc. And he's actually a paralegal and a
Okay.
legal document preparer. So that's kind of like where the law part comes in. He kind of just seeing the cases that he's doing, and he deals with also some types of medical malpractice,
Mm-hmm.
insurance work, stuff like that. And I'm like, this is fascinating. And I kind of like wanted to learn more about it. And that's kind of how I stumbled into legal nurse consulting. And so I do that with my husband. Sometimes we're not doing the same cases at once. He has his own caseload, I have mine, but I've kind of been doing that for some time now. Alongside everything else. So, as you can imagine,
Yes.
that's kind of like why I say, "Woo, you just never know." It's like,
Not,
oh, this opportunity can lead to that opportunity, and then the networking is so important, right? You just never know who you're going to meet, and then who you actually make an impact on, and that's the biggest part. Hmm.
yes, and I think that's important because so many new nurses coming in, they think that they're going to be in one place forever. And then they get so bogged down on those units, even with the toxic work environments or things like that. They
Right,
stay there for so long because they don't
right,
see a way out. But I
right.
think that it's very important because you said that there are so many different variations of things that you can do in nursing. So
Absolutely.
learn your way around the nursing field. If it doesn't work out on the floor, you can go to the OR. That's what I did. I was on the floor during COVID. I was like, hold on, I'm losing too many patients. Now I got to remove myself
Right,
from the bedside. Went into
right.
the OR, and I've been here since with some sparse other things in between leadership roles, all of those
Okay,
things. But at the same time, it gave me a leeway to be like, hey, if I don't want to do this, I don't have to do this. Like there
absolutely.
are so many variations. And Go
And
ahead.
just yeah, definitely wanted to piggyback off of what you said. Is so many variations for a reason, right? It's just nursing. If anyone looks at the history of nursing, we're in the backbone of history. I mean, realistically. But also, I urge nurses, especially in this climate, especially with what's going on in healthcare, what's going on, unfortunately, with this administration cutting Medicaid. Um, if people think Medicare is not going to go anywhere, think
Yeah.
again. Like they're going to go after it. They're going to go after the ACA. So I think, and we're seeing hospitals close.
Yeah.
Hospitals are closing left and right. So I think as a nurse, it does behoove you, regardless of what you're doing, learn something else. Like always have multiple eggs in your basket and diversify your portfolio. That is the best thing you can do for yourself. Because God forbid if something happens and
You
that hospital all of a sudden have to you can pivot.
have it.
You can pivot and it's not a problem for you. I just think like to your point earlier, you get pigeonholed because you get comfortable, right? You got
Exactly.
that paycheck, you get that paycheck every 2 weeks, you got them benefits, you have a family to take care of, you have yourself to take care of, and I get it. And it's security, but as easily as you have that security, it's the quicker it can go away. So I just say for any type of nurse, get your skills up, but then start branching out. Even if you're doing something like once a week or something that's outside of what you're doing, you're getting that experience in. So, yeah,
Even look at our VA nurses who are working and not getting paid.
exactly.
So you do have to learn how to pivot. And I would also recommend that if you are in nursing school, go get a nurse externship and make sure that that nurse externship is teaching you various things. My nurse
Yeah,
externship put me into every specialty that known possible. I was a home
right,
healthcare extern, I was in med surge, I was in the ER. You have to understand that one day you might like this, the next day you might not. And then
right.
one day something that you love may be snatched away from you, like
Correct,
we're seeing
correct.
right now. So learning how to be flexible in healthcare is something that is very important.
Absolutely. And that's so funny you say that because that's exactly how I got into the operating room through an externship.
Hmm.
I was still in nursing school at the time and I did an externship in the summer and they had a slot open in the OR and they said, we've never done this before. We've never taken on a student nurse, but we're going to try it, right? Because you always need OR nurses.
Too.
And I found it fascinating. And I learned those 8 weeks. It was just an 8 week program. But because of that 8 week program, they basically said, hey, Cambria, um, we want you. We know you haven't graduated yet. You got a semester left. We will hold a spot for you, and we will train you. And so people are actually willing to train you if you put yourself out there. That's kind of like where I'm going with that. It's just to your point, people pigeonhole themselves so much and just don't see the big picture and externships is a great example of that. You can learn so much just doing other specialties and then you never know, you may hop onto something that will light your fire and be like, wow, I had no idea. So yeah, that's a great point you just made for sure.
But I did want to ask, like, for our listeners, can
Hmm.
you explain your role as a legal consultant and a health administrative executive consultant as well?
Yes. Well, yeah. So legal nurse consulting, even though it's been around for some time, it's still pretty new to people. And what we are, because there is a whole group of us, and we actually do have a national association for legal nurse consulting. We are in the background. So there's two parts to this. Anytime people see legal nurse, they automatically think attorneys. No, we're not
Okay.
attorneys. So we have to be very clear with that. There are nurse attorneys. So let's put that there, right? There are nurses that actually went back to law school and got their JD and passed the bar. What we are, we work directly with law firms, insurance companies, hospital clients. Um, when there's actual cases, legal medical cases. Usually it's negligence or tort actions, and they need a nurse. A lot of times a nurse is involved, right? In this type of lawsuit, civil lawsuit. And they need a nurse to actually look through medical records,
Okay.
actually see, hey, is there a gap in this documentation, or does this case have merit? That's the biggest question. Like anyone can say, oh, I want to sue, but do you actually have a case based on the medical records alone? Like, and did this nurse or nurse practitioner, did they do anything out of scope? And so you're there to help the legal team answer that question, yes or no. And a
Gotcha.
lot of times, depending on your reporting and how you articulate the case, um, if it before it even goes to trial, if it does, 90% of cases don't even go to trial, as we all know, they'll get settled. But if it goes that route, they may want to depose you. And I've been deposed a couple of times on my interpretation of the medical record, why I thought this practitioner did X, Y, and Z. And so that's what legal nurse consultants do. So it's a lot. It's a niche category that any nurse can get into. First of all, you don't have to have decades of experience. You really just, we've all been into an electronic medical record. We all know how to chart. We all know what to do's and don'ts. We all know what our scope of practice is. That you can become a legal nurse consultant. I think the only nuance to it is that there are certification classes. They're online, not super expensive, but they actually go into the legalese of what's a tort, what's
Hmm.
this, So, and that's the part that you do need to learn. And then the biggest part of legal nurse consulting for me, majority of nurses are 1099 employees. So you do have to have your own business model. Um,
Okay.
as far as taxes, no, the appropriate way to deal with your tax and your business part of it. There are law firms that do hire W2 nurses, but it's rare. A lot of times they want subcontractors or contractors to do this work. So that's like on that side of the house. And then the other side of the house of consulting, I've actually consulted and worked with different healthcare agencies, healthcare systems, as well as even nursing organizations or nursing accrediting organizations on consulting. Um, I've actually worked with different accrediting bodies on just a lot of times they just need advice. Like, in your humble opinion, this, that, and the other, what do you think? And that's really as simple as that.
Just
And it's just simple as that. And people will pay you. And people will pay you. And so it's interesting that, they kind of look at your experience, obviously,
that.
and what you've done, and then they want to pick your brain, based on this, what do you think? So I've even assisted in the competency exams for operating room nurses.
Okay.
I've helped write the actual exams for the CNOR, the CSSM exams. I actually was part of the first group that wrote the CS, because that's the, for those who don't know, that's the Certified Surgical Services Manager certification. And so I was part of that group that developed that exam and developed that certification. So that's also part of the consulting work that I've done as well. So it's just a lot of, like, you kind of like sprinkle here and there
Oh,
of experience, but it's interesting that people do want to know from nurses, which is a good thing. We want nurses to be in the boardroom. We want nurses to be out front giving their expert opinion, because at the end of the day, we are experts. And I think people need to embrace that. Even for me, I need to
yeah.
embrace that myself, that you are an expert. If you, especially you've taken care of patients, you know the to lack of a better word, the nonsense of like the hierarchy, dealing
Yes.
with administration. You know it. You've seen it. You've dealt with Joint Commission or DNV or different types of accrediting bodies. So you know it. It's just, I think people kind of get into themselves that they're not
Yeah.
experts, but you are. You're an expert. You're a nurse. You're an expert. So
Most people don't feel like they're experts because we are often pushed into this place of imposter syndrome. Like, I could not be an
yes,
expert. How am I an expert? So you're
yes,
constantly questioning yourself or your experiences or your experience as a nurse in general. So you don't
yes,
think that you have all of the things to become all of this. But
Yeah,
for
yeah,
the
I completely agree. And I think it's just an old school mentality
Mhm.
of, first of all, hospital systems and how, the physicians all the way up here and the
Yeah,
nurses down here. And then you have administrators that, that, not, 9 times out of 10 are not even healthcare professionals. So they're kind of mostly business people. So
yes,
even
don't
business
mess with
people
your
have a hierarchy. Yeah.
budget.
So I think we got to really, I personally, hopefully see in the future us change that narrative. It's just, it's old school, it's tired, and unfortunately, because of that, you're not listening to the people that are at the bedside
Mhm.
doing the work, doing the grunt work, and then you wonder why people are leaving the bedside. They're leaving because you're not listening to them. They're
Yeah.
they're leaving because they are sometimes in danger and they don't feel protected. So, I mean, why would anyone, regardless of the amount of studying and board exam prep and everything that you do, why would you stay somewhere where you don't feel heard and you don't feel
Mhm.
appreciated and you don't feel, and that's the problem. And I think it's, if we can nip that in the bud, I mean, we would be an amazing group of practitioners nationwide. I think the United States have a really hard time recognizing nurses. It's
Yes.
just it's just as simple as that. It's just they don't recognize our experience, our education, our excellence, and that's, I just don't, I don't know why that's still a problem in 2025, and we have to fix it. I think no one else is going to fix it but us. We have to do
Yes,
it, and like having conversations like this
out
helps.
of the house. Like
Yeah,
it literally,
absolutely.
it has to come from us. We have to
Yeah.
address the issues on our units. And I would say even for myself being an OR trauma charge recently at a pediatric trauma center and seeing policy and procedure and seeing that we weren't operating within those lines and then bringing it to the attention of my boss and they were like, "Well, that's a gray area." And I told them, "Hey, no, it's black and it's white. There is
That's right.
no gray area, especially
Right.
when you're dealing with trauma. There is
Correct.
absolutely no gray area." And
Correct.
so when you're dealing with things like that, you have to address them because they have been living in this cycle of not doing the things the right way, that if you don't address it right then, your license is always at stake.
Correct. Correct. That's the key, right? People forget we all have licenses.
Mhm.
We all, and you can do something to the T, but if it is not part of a policy
Yes.
and someone gets hurt, the hospital is not going to protect you.
The
They're
hospital
not.
will do anything to dig a hole in the dirt and cover it up and
No,
then boom, everybody.
no,
Everybody
exactly. And I think,
they will
I
throw
think
you under the bus.
they will. And I think that's also lacking in nursing curriculum, because we need to be teaching the nurses that are graduating, that are coming out, that, this is a license that you're held liable for. So
Yes.
if you're not following procedure and policy, first of all, you need to know your policy and procedures. First of all, you'd be surprised so many nurses that don't even know what their policies are or
Mhm.
how to find them or how to locate them. That's a problem.
It
You should
is.
know that. You should know your scope of practice. It's just basic stuff. And then you should have liability insurance.
Mhm.
Do not rely on these hospitals to protect you, because they will not. I've
No,
seen too many cases of nurses getting thrown under the bus. Risk management's not your friend. It's
they
just, I'm
aren't.
sorry, they're
They're
there to protect the
protecting
hospital.
their hospital. Their
Yes,
bread and butter. They're going to protect their hospital.
exactly. So I think we really got to sharpen that up. And again, to your point, it's black and white. It's at the end of the day, because that's what I'm seeing now. I'm someone that's far removed. I'm not a part of that hospital because that's conflict of interest. I'm not part of that nursing team. I don't know what happened with that patient. I'm literally just looking at a record. So if
Mm-hmm.
the record is saying something and then I pull up policies and procedures and it's saying something else, that's a breach. That's a problem. So I think people just have to think when they document and when they do things, that someone 10 years down the line, right? It's not going to happen right then and there.
Mhm.
It's 10 years down the line.
And you can't even
Someone's going to
remember
look,
the patient.
right?
Whereas
You're not going to
now,
remember it. Exactly.
remember
You
that patient. Who was that? But if you document
exactly.
appropriately, guess what? If there are no
Exactly.
holes in your documentation,
There you
you
go.
are protected because,
There
of
you go.
course, you may not be able to remember that patient, but your documentation is so pristine that you have told the story of what happened. And that is
Precisely.
what is very important
Correct.
because I was recently talking to Leslie on another episode, and she
Mhm.
is on the documentation side of
Mhm.
medical claims. And she was like, I don't even normally feel like a nurse anymore. Like, I just feel like I'm pushing paper. And I said, no, you are a nurse because we need you for those things. But on
Yes.
my side of things in the OR, we have to make sure we're documenting appropriately because sometimes people don't spell the procedure appropriately. Now you got an
Right.
otomy instead of an ectomy,
A
and it's
big
a whole
difference.
procedure
Right.
because
Right.
you didn't listen or you didn't clarify in
Correct.
time in the debriefing what
Correct.
surgery it was.
That's
And
correct.
so these are things that are very important, but people don't consider them important because you're scared of the surgeon, so you don't feel like you can speak up, or you don't understand the back end of things that that patient needs for this to be documented appropriately so that their insurance can cover it.
Correct. Correct. And I think also it's just a catch 22 because, you're in the OR. I've been in the OR. I
Hmm.
had to grow a spine. It didn't come
Yes,
naturally, right? It didn't come naturally. So I'm not going to sit here and say, oh my God, right after school and I got into the OR, I was a badass and I knew what I was doing.
have to.
Absolutely not. And so that's a learned experience. You have to learn the back to grow a spine and back for it. But I also think hospitals definitely need to do a better job protecting their nursing staff.
Hmm.
If I have the balls to tell you this physician is out of control and he's yelling and cursing at the staff in the
Throwing
operating
stuff.
room and throwing things, and you're allowing that as a hospital system,
Mhm.
then that's a problem. So I think you got to cut things at the root. And I get it. It's a business. Everything's a business, right? This surgeon is bringing in dollars to the hospital, but if he throws something and it hits that nurse, is
Mhm.
his business worth the lawsuit? Because nurse will sue. So is it worth
But
that?
see, they count on nurses not saying anything.
Right. And that's the
See,
problem.
now we have become accustomed to, hey, if you do this, we're going to do something about it. But the culture prior to nurses actually suing and it being public that they're suing, nurses would just sink in their seats and just
Right.
take it. And their
Right.
bosses would tell them, well, I remember one girl, I ended up doing a travel assignment and she ended up having the same residency that I did. And she ended up leaving. And she said that our previous boss told her that she had to accept racial comments in order to get ahead.
Wow.
So, and she told me the same thing. She said, if you want to make it somewhere, she pointed out her degrees on her wall. She said, if you want to be somewhere and make it somewhere, then sometimes you need to stay in your lane.
Wow. Wow.
So that's the type of culture in some of these
Yeah.
hospitals that they're creating.
Yeah.
But you do have to put your foot down and you have to escalate it. You have to document it. You have to, and even
Correct.
though sometimes it feels like a lot, it feels like you're
Right.
doing a lot, you do have to do that. And if you got to move on, then you need to move on.
Yeah, and you have to protect yourself. You
Hmm.
just have to protect yourself because I'm going to be honest, it's a job,
Hmm.
right? Your life, your health, your mental health, your self-awareness,
Important.
all of that matters first. Your license that you work so hard for, that is above all no, priority number one. And I think nurses just need to remember that piece, right? It's just at the end of the because God forbid something happens to you, they'll
Job
replace you in a
placements.
minute. They will replace you in a minute. They
Exactly.
are. It's not a problem calling. They just call an agency and get another nurse in.
Fill
It's
your
just
role until they find somebody permanently.
right, right. So I think to your point, yes, it's this toxic culture of this nonsense behavior that's being accepted. And I think in this day and age, we should not be accepting it anymore. Like you
Mm-mm.
said, document, document, document. Yes, it's going to take some work, but I'd rather be someplace where I'm safe.
Yes.
It's just at the end of the day, are you safe?
Mhm.
Right? That's what matters. So, um, yeah, I
And I
think
think
we
that
have a lot of more work to do on that for sure.
we do. And I can also say, just to let you know, that your documentation may not work right then when you're there at the facility. When you
Correct.
leave and then they have it now, it's a microscope on that unit.
Correct.
My boss that said all of these things a year later was walked out because she did that
Wow.
consistently.
Wow.
So participating in that type of behavior for the longest time, and I wasn't the only person who had reported it. And then after me, more people started to report it.
Yeah.
Now that person has been walked out. However, you have to say something because if you don't say
Absolutely.
anything, guess what? They don't know anything.
Correct. And then if you're not going to advocate for yourself, right?
Mhm.
How can you advocate for your patients?
Yes.
Right? Like how does that work? Are you
Hmm.
speaking up for your patients but you're not doing it for yourself? That seems counterintuitive. So I just think um you do have to grow a spine in nursing. It's just not for the weak. It's not.
Hmm.
I don't think it'll ever be. I mean, because you're dealing with people. You're
Yeah.
dealing with people that may not like you. They may not like the color of your skin. They may not like what you represent, but you still have to take care of them, right? And so you do have to grow that spine. But I say the biggest advocate for yourself is you. You just have to do it.
Hmm.
So, yeah,
Yes, and we're not even only advocating for ourselves. We also have to advocate for our scrub techs, as OR nurses. We have to advocate for
down the line.
our
Correct.
CNAs as on the
Correct.
floor nurses. You have to make sure that you're able to actually be vocal. You do,
Correct.
even in your discomfort, you have to say
Correct.
something.
Correct. And that's such a great point, right? As nurse, especially registered nurses,
Hmm.
I mean, you're delegating, you have a whole team working side by side with you and that look up to you and say, well, if she's going to tolerate that, then I guess it's okay. No, it's not okay. And so, yeah, absolutely. The whole team is involved. And so I just think again, there's so much movement right now, especially with healthcare and everything like that. And I do see a shift somewhat of just people
Yeah.
not tolerating nonsense. They're not tolerating bullying behaviors. They're not
Hmm.
tolerating racism. They're being more self conscious and aware of things that could impact their livelihood and their license.
Hmm.
So I do see a lot more people speaking up and actually being as bold as going to obtain attorney and legal counsel. I mean, you have to do what you have to do to protect yourself and your patients, but we still have a long way to go. I just feel that even me stepping away from the bedside, I'm still pretty much still in the mix of what's still going on, and so many nurses reach out to me, as you can imagine. I didn't expect as many nurses and even healthcare professionals, PAs, doctors even, they do reach out to me and tell me their stories of what they're still going through and enduring, and it's still a lot. It's not where it needs to be. We can't sit here and pretend it is, and it's just but we're hoping that it'll get better. We're hoping, but
Yeah, we
people have to speak up. People have to speak
just.
up. You cannot stay silent, and I think that's why my channel, I've made it a mission not just to speak about healthcare advocacy, but just advocacy in general,
Yes,
like equal rights. I don't, it's just you can't be a healthcare professional, but then be a bigot. Like, what?
exactly.
Like, you can't, it's just, it doesn't make sense. And, or an anti vaxxer. You're a healthcare professional, but you don't believe in the science of being a healthcare professional.
Yeah. Like
What?
what is science? And
Yeah,
that and see our biology brains can't wrap our minds
right,
around that.
right,
It's the
right.
biology brains. Like I got my
Right.
bachelor's in biology as well. So
Oh, okay.
it's biology brains that it's like, hold on, hold
Yeah,
on.
it's like, are you just here for a check? Like, I just don't understand that. You cannot be in this field and
Hmm.
don't understand the science behind why we're doing what we're
Why?
doing.
Hmm.
Every single intervention, every single decision is based on science, every single
Hmm.
one. So to hear, like, I don't believe in vaccines,
Well, what don't you
what?
believe?
So what?
They're here,
So
they exist.
they exist for a reason. And so you're in healthcare, like you're in the wrong field, honey. You need to move on. Like that's dangerous to me that you're willing to put an elderly person or an immunocompromised person or a child, an infant that don't even have an immune system yet in harm's way because of your beliefs. That's a problem for me.
Mhm,
So, like, I call those things out, and I think that's what people like about my channel or dislike because I get hate mail too,
mhm,
which is fine. But it's like I'm gonna call it like it is, and then I also call out bad actors. You're a
mhm.
nurse, but you're stealing. That's a problem. You're a physician and you're fraudulent. That's a problem. Like I'm calling you out. People are saying, "Well, why are you saying names?" No, this is public information.
It's not
They're
private,
it's not private, and
but it should
they're
not
being
be private.
tried and convicted.
It
They've
should
been
not be private.
convicted. And if I'm a patient, which I am, we're all patients, you want to know who's taking care of you
Mhm.
and you want to be safe. So I think that's kind of like how I kind of snowballed into advocacy. Like you have to advocate for yourself, but then also you have to speak up. If I'm saying nonsense, I'm going to speak out about it. If that means I have to call out, I think one of my most recent videos was about that Walmart shirt, that
Yes, I saw that.
had the Nazi
Yeah.
symbol underneath the black, and then all of a sudden now it's no longer, you can't find it on Walmart. Good. That means that someone listened, someone reached out to Walmart and said, what is this? Like that
Mhm.
matters. You speak up for people that can't speak for themselves. So I just don't understand a lot of the commentary that I get, especially on my page, from healthcare workers is astounding to me. And I'm like, are you cool? Like, that's kind of like what I think in my head. Are you okay?
No.
No, you're not.
I
Eh,
think a lot of these people are people who have a different stance just based off of their own personal beliefs. It doesn't matter
Yeah,
about their patients. It doesn't matter about what healthcare stands for. Healthcare, I remember when I first started and they said you should not be biased. But how do you not create biased environments whenever you start working? They put all of the African American or Black people on night shift and put a full
tell it.
staff of white people on day shift. And they
Correct.
don't want to address those issues because continuity of care matters and
Right.
representation matters. And then I'm here having to tell another nurse, well, if you don't feel like you can take care of that patient, you don't need to have that patient on your load. And I shouldn't have to do that
Hmm.
because you should feel comfortable taking care of someone who looks like me because you're
Correct.
speaking to me like I'm a human being.
Right.
So you should be able to do the same thing when you take care of your patients. A lot of people they really don't care about the people that they take care of.
And
So
that's
are
not
you really taking care of
acceptable.
them?
Right. You're not. You're not. And that's unacceptable. People, especially these employers, these health, they got to step up and vet
Mhm.
better. Like there's just no excuse for it. There's no way you're taking care of me and you haven't taken your COVID-19 shot. Like there's just no way. I'm immunocompromised myself. It's
Mhm.
like I don't look it, but I am. I have lupus. So you wouldn't tell by looking at me. I take care of myself, but God forbid someone with a serious infection comes near me, all hell can break loose. So it's like you can't tell what people are going through just by looking at them. And
Yeah.
that's why in healthcare we treat everyone the same, right?
Mhm.
It's just that's why it baffles me, and especially now in this age of social media, people are just way too bold to be ignorant. I'm gonna just call it to be ignorant, loud, and wrong. You can't be all three and be in healthcare. You just can't. You
Oh,
have to be willing to learn. You
mhm.
have to be willing to learn. You have to be willing to take some, constructive criticism. You're not
Mhm.
going to know everything, but then you can't say, "Well, I'm not going to take care of this person because of this, that, and the other." What? Then you
Oh,
don't need to be here. I
I've
will
seen
clock you out. Yeah.
look at a patient from outside of the window during COVID because they didn't want to go into the room. How is this
Wow.
an assessment? Tell me what you're going to document. What are you going to document when you go sit at your computer?
I look through the window and
No, they're gonna document that they went into the room, they
Right,
assessed,
and assess, did a full assessment, right?
they auscultated the lungs and everything. They're gonna say that they did all of these things when
Yeah.
in reality you stood out the window and you looked at the patient. That I feel like that seeing that happen very, very young in my nursing career gave
Hmm.
me a spine very early. Like I
Yeah.
knew that I had to advocate for my patients because my patients didn't have a voice of their own.
Yeah.
And I had to teach them how to advocate for themselves when I'm not here. When I'm not here, these are the things that you say because you need to be heard.
Of course, yeah. And good for you. I wish there was more of us
Yeah.
that did that, right? It's just and again, nursing as a whole, we're talking about the exceptions, right? But
Mhm.
nursing as a whole is a beautiful career and there's plenty of people that want to do it for the right reasons. I just think we do have bad apples and I think we got to root them out. It's just, and that includes managers, charge nurses. That includes higher CNOs, administrators. Like you got to root the bad seeds out, and then we have to reestablish that trust again with our patients because
Yes.
right now,
Well,
as a
number one trust.
whole, yeah,
We're number
yeah,
one
as
trust now. No one trusts us.
right. So it doesn't help. And yes, I do report out on nurses that are not doing what they need to do and everything like that. But honestly truly believe that we are lacking this type of news in mainstream media. The stuff that we need to know about our healthcare. We need to know that our premiums are going up. We have to know this stuff. And so it to me, waiting for ABC or CBS to do it when they're going to sugarcoat it anyway and put their spin on it, it doesn't do us a service. It just doesn't. So I think that's kind of like what drives me personally to say, you know what, this is the best way for me right now to advocate on a bigger scale, on a national scale of right now we're not where we need to be. And
Mm-mm.
this is how we can get there. So um, and I tell people take it or leave it. You know, you can just scroll. You don't
Mhm.
like what I'm saying, but what I'm saying is facts. So you may not like it, and that's okay. But this is the state of where we're at in healthcare, and it's just not great right now.
And I'm
So
glad that you are unapologetic in what you do
yeah,
and
yeah,
unapologetic in what you say because so many times we feel like we want to say the thing, but we don't know how to approach it because we don't know what feedback we're going to get from it. And it's not easy being on social media and
no,
saying what not only your truth, but the truth
right.
because people don't necessarily want to hear that.
That's
They
correct.
want us to package it up in this pretty box and hand it to them, but what we're seeing right now is not pretty.
Correct.
The things that people are going through is not pretty.
Correct.
And so actually having the the backbone and the spine that you developed all those years in the
Hmm.
OR to
Yes,
now being able to vocalize how it is the world is messed up right now and we
it
have to
is.
do something. We have to say something because if we don't, who is?
Exactly. And that's the part. It's just we're just how are you comfortable just sitting and doing nothing with
Hmm.
everything that's going on, right? Like we're talking about healthcare, but there's a global of
Yeah.
things going on that directly affects us. You may not know it, but it affects you.
Yes.
Everyone has to go grocery shopping, right? Everyone has to have utilities. Everyone has to pay rental costs or mortgages.
Hmm.
Everything skyrocket and it's becoming unsustainable to live in this country, but you're going to sit here and say, oh, it doesn't affect me. Really? Like it's just you can't just sit here and stand idly by when
Hmm.
and not do anything, and that's just not how I was raised. It's just not my fiber to just sit
Hmm.
around and say, oh, life is peachy and life is great,
Yeah.
when I know we're trying to revert back the 50s or the 40s. Like what are we doing? So that's why I urge even other healthcare professionals join the fight and the call to make sure our people are informed of what's going on. Because the worst part is we just have way too many, unfortunately, ignorance
Mm-hmm.
that's out there. And these are the ones making decisions on how we vote and how who's in office and everything
Yeah.
like that, instead of actually learning and willing to learn the actual truth and then make an informed decision. And the same in
Mm-hmm.
healthcare. You have to be informed about what you're doing. Um, so that's why I just can't sit idly by. Just never been that person. It's just not me. If anyone knows me personally, is like, yeah, Cambria's not that girl to just sit around and say,
Right. Like,
yeah,
you
we're
know,
just
you try to
no.
bite your tongue, but it still kind of comes out.
Yeah, yeah, listen, I was raised in Bed-Stuy, New York, so Brooklyn. So you have to, especially as a female, you had to have a thick skin. You have to uh, just grab things by the reins. And that upbringing helped me become the shape who I am today. It's just, I just don't take mess. And I don't think anyone should. I
Yeah.
just don't, no, it's not acceptable. And call it out when it happens, not a year later. When
Yes.
it happens, call it out. So I think that's where I get my drive from. And hopefully, regardless of how big or small any of our voices are, we're making a change, we're making a difference. And I
Mm-hmm.
think we are. I do think we are. I've never seen so many healthcare professionals now speaking up
Yes.
about insurance and about
I'm
just,
tired.
yeah, yeah,
Honestly, I just started a new job, so I had already enrolled, and I was like,
okay.
okay, this makes sense. I'm doing the things I have, well, I had my insurance license. And so I kind of understand what is going on here. And then they're like, oh, you need to re enroll. Like I just
Mhm.
enrolled, like open enrollment is here, so you have to enroll again. And then I'm looking at the comparisons from
Don't
a month ago to
tell
now,
it. Mm.
from my PPO to the high deductible plan, and the difference between the two initially was very little. Like my
Right,
out of pocket would have been maybe 100 to 150 more for my PPO, and now it's almost $1,000.
right, right,
So, and I'm like, okay, so I'm paying for my health care when essentially, if I didn't have to have my child on my health care, I would just go and pay monthly at
right.
a doctor that I know who allows you to pay monthly with
Self pay, right,
unlimited, yeah,
right,
unlimited services and discounts on x-rays, discounts on medications. And for me, that would be my best bet had if my baby wasn't so young.
right. And then imagine your scenario down to someone who's only making 20, $30,000 a year, right?
Exactly.
With five or six children. And it's like, then that's kind of like how I see things. Like, yes, we're in the more privileged status because
Yes,
yes,
we
we have
are.
careers
Hmm.
and we do have careers that are sustaining us, but there's so many people
Who
that
do
are
not
in the
have that.
low to low poor class that just don't have it, but yet they still have medical conditions. They still have chronic conditions that
And
still
they
need to be
need
taken care
insurance.
of. And they need the insurance. So that's why I just didn't understand um, all of this nonsense going on with the subsidies and things like that. And now people are seeing the sticker shock and people are pissed now. But I'm like, we've been saying this is going
Have
to
been
happen.
bullied to the hills. Hey, this is gonna
Right.
happen.
It's
Hey, this is
going to
gonna happen.
happen. Yes.
But no, nobody understood what had happened until it affected them.
No. So
So
now we're going to have thousands of people uninsured. That's what's going to
yeah,
end up happening. People cannot
just drop
afford
your
this.
insurance.
Yeah. So they're going to drop your insurance. More hospitals are going to fill up in the ERs or urgent cares because now people are not going to see their preventative, their PCPs or their specialists
They
because they
can
can't
afford
afford
it.
it. It's just at the end of the day, you cannot afford it. It's just the cost of living in this
Mhm.
country does not sustain healthy living. It just doesn't.
And
So to
then,
sit, yeah,
whereas back in the day, you used to be able to go to your appointment and not have to pay up front. They would bill you.
right,
Now you got to pay up front.
yes,
Now you're
right,
not even going to see your PCP without making that payment.
correct. Exactly.
So
People just don't have that. They
yeah,
don't have it like that. And then there's just so many judgmental people. Why don't you have months of savings, stuff like that?
that's
When
not a
you're poor,
reality.
that's not a
Not a reality.
option.
And
They're
that's
living paycheck to paycheck, and
you're
that's if they're getting paycheck to paycheck.
exactly.
So
You're choosing between eating today and going to your PCP. So
that's
what is
correct.
more important to you and your
Ex-
family? Eating today.
Exactly.
And
Exactly.
so I always tell people if it wasn't for Peach Care, and I'm from Georgia, if it wasn't for Peach Care, I wouldn't have been able to go to the dentist. I wouldn't have been able to wear glasses. I wouldn't be where I am today had it not been for being on government assistance. So when
Hmm.
people are, oh, why don't they have this? Why don't they have that? Well, some people don't. And that's
They
just how
don't.
it is.
And it's inflation. The cost
It's
of
so
living,
hard to keep up with
unless
everything.
even multimillionaires are leaving the country because the cost of living is ridiculous. It's
Hmm.
outrageous. So you can't, I mean, you can't sit there in good conscience and say, "Oh, I'm everything's straight here." It's not. It's not. And so I just think people are so quick to judge. Just first of all, there's bots, so you gotta take them out of the equation.
Oh
But
Lord, the bots.
right, it's like so you have that, but then you have actual people that are just so quick to go to judgment, knowing that you're one paycheck away from being on public assistance.
Exactly.
So technically, we all are. You're
Mhm.
if you're unemployed for a certain amount of time, where's the money coming from? So, and the job market right now is so saturated because of all the layoffs,
Mhm.
federal layoffs, the people that are leaving voluntarily because of the shutdown. You have people, all these hospital systems that are closing. All of those people are gone, they're looking for jobs. So you're competing with everyone for
Mhm.
the same position. It is not the same job market and climate that it was back in 2020 or back in 2019. It's just not. So people just need to wake up. And my again, my platform is more so not of judgment, but
Mhm.
of true education. This is what's happening in real time, what's going on. Not for a millionaire. This is for the average American.
Mhm.
Their health insurance is going up, and this is why. And if you can't understand that, you can definitely contact me directly. I will break it down even more for you. I'm
Mhm.
willing to do that. But I think it's just the discourse instead of just listening and understanding that just because it's not you, don't mean you don't have to be empathetic towards it.
Exactly. And then I'm thinking like a lot of these people have family members that are in similar situations.
Absolutely.
And so
Absolutely.
how can
Everyone.
you have empathy for
Yeah,
people that like that could be you. It's easy for that to be you. I don't think people realize how easy it is
it
for it
is.
to be
Yes.
you. I've talked to so
Absolutely.
many homeless people that one day they were here and then the
Yeah.
next day they didn't have it.
Yeah.
So
Yeah.
whenever we're looking at the grand scheme of things, you have to have some sense of empathy when it comes to what we're looking at. Because if you don't,
Absolutely.
you are really playing yourself.
And
Because
that's the perfect way to say it. You're playing yourself. Exactly. This is the
it's
real world. This is not some fantasy land. And like I said, every single person, after a couple of paychecks come, again, the bills don't stop.
yeah.
They don't care. The bill collectors do not care what you're going
Oh, and
through.
when they do, they compound.
Exactly. So,
When they do,
exactly. Exactly. So
and
it's
then
just, I
they
think
want their
people
money
have to
right
wake
away.
up.
Mhm.
Right. People have to wake up. I think it's more so, it's just, I think people are now starting to wake up. We're a little bit too late for that. But it's like, now that, I mean, with this government shutdown, we still don't know. I don't think, I haven't gotten an alert. We don't know what the final vote's going to be on that. But
Mhm.
from what I can see, the subsidies are going away at the end of the year. People are going to have to just drop their insurance or pay thousands of dollars that they don't
I heard
have.
they open back up. I heard they open back up with the pinky promise.
So
They
there's a
open back.
couple of things. I don't think they've gotten the final vote. I know over the weekend they had the procedural vote, and this is
Mhm.
where the 8 Democrats sided with the Republicans. They still
Yes,
have to do a final vote. I don't think that's happened yet. And then
they
it
said
still has to
it
be,
in December.
yeah, and then they said it still has to be signed by the president. So none of that's happened yet. So the government's still closed, to my understanding, from this
Oh,
time
okay.
of taping. But the whole big hoopla from today is from the procedural vote that happened last night.
Okay.
So there's still one more vote that has to happen. So regardless of how that goes, we're still going to be back at square one because the government's going to shut down again in January. January 30th is going to shut down again. We're going to be back at square one. And at the end of the day, it's just people have to just stay informed
Mm-hmm.
with what is going on. And then when it's time to vote, vote.
Oh,
Don't sit on your hands and say, I'm not voting this year. Like, don't, it's just, it's unacceptable at this point to not vote if you're
mhm.
eligible to vote. So, um, between everything that's going on, I think just people just have to realize, and also just like I said, grow empathy. If you
Yes,
don't know how to be empathetic, you need to learn. You need
yes.
to learn quickly because
Really,
it could be you. That's how
it
I
could
always say it could be you and where you need help, and people will remember how you treat them.
yes,
They'll remember.
they may not remember exactly what you said. They may not
But
remember
they'll
exactly what you did, but they remember how they felt whenever you did that.
Absolutely.
Mhm,
Absolutely. And that goes for how you treat your patients, how you
mhm.
treat your colleagues, how you treat others on social media. It's just, it matters. So I think people just need to uh, get a grip like
Yes.
quickly and just be empathetic towards each other. That's all I ask for. So,
Recognize where we are.
yes.
Recognize simply where we I think that's the very basic foundation of if you tell me to go to the grocery store and I can't buy any eggs, where are we going in the economy? And I
Correct.
remember when I was younger, they would say you can always tell inflation by how much a bottle of Coca-Cola is.
Okay.
So when I was younger, you could get it for 50 cents.
Right.
Now 250, $3
Right.
depending on where you are.
Correct.
So you can see how much from then to now is grown, but guess what hasn't changed? Minimum wage.
It has not. And that's the core root of all of
Mhm,
this. Everything's going up but the wages.
mhm,
And you expect people to still live. Like the math is not mathing. And I think that's where people forget. Like minimum
mhm.
wage is still 725 in 2025. What?
Yeah.
Like that's absurd.
From
So,
2008.
yeah, that's absurd.
Mhm,
How can you expect people to live off of that when, to your point, Coca Cola costs $2.50 or
mhm.
eggs cost, depending on where you're at, $4 or $5 for a dozen? That's your
Yeah,
check right there. So I think, again, back to me, like I said, people just need to understand that it is not okay to look down on people that are poor because they're poor for a reason. It's
yeah.
because of the society and the racism and the discrimination behind that.
Mhm.
The fact that there's no conversations about minimum wage is atrocious,
Yeah.
but we're fighting over other things. Like that doesn't make sense to me. So yeah, so you made an excellent point. It's I think until we get that under control, like I said, we're going to see an exodus of people. People are already planning to leave
Yeah.
the United States, not just because of wages, but also just because of the
The climate.
climate. The political climate right now is not safe. It's just not safe for people. And so you can't blame them. It's just you can't
Mhm.
blame them if other countries are willing to take Americans in and actually welcome them. So um, I always say to anyone, do what works for you and your family to make sure you're safe. That's what matters at the end of the day. But something's got to give, and people need to wake up. They really
Yeah.
do. Yeah.
Yes. And I wanted to ask you, what can healthcare professionals do to stay more informed and help to push policy forward?
Great question. Well, I honestly think you do have to just stay informed. There's so many newsletters that are actual good resources right now. Healthcare.News.com and actual there's there's so many newsletters I am subscribed to. It's sickening right now. So like my whole
That's your
email
job.
Yeah, my whole email is a hot mess. So maybe that's not the best question for me, but but no, but for real, first of all, like definitely there is actual credible newsletters that are factual, that are giving you real time information about what is going on as far as healthcare policy. Um, Even following people like us, right? It follow creators, and I always say fact check, right? Don't just follow what people are saying. Even when you're reading things, double check it, look it up.
Yes.
You can Google it, look it up, and read it for yourself. If someone's saying the USDA, like I said, the USDA had a memo, you can easily Google it and read the whole memo. Like read it for yourself. And I think that's what people, there's a lost art in actually researching and
Yes.
reading things yourself instead of just scroll, scroll, scroll. I'm just going to listen to it and run with it. I always say don't ever take anything at face values. Look it up, read it for yourself. There's plenty of journals that
Mhm.
are dedicated just to this topic and will get good information. But I think there's a lost art in research, just basic research.
It
You don't
is.
have to be a PhD to do it. Just read. Um, and so I definitely recommend that, as well as being involved. If there are organizations and associations that that are near and dear to you, especially if you want to be and healthcare advocate, like there's Nurses United and there's so many other great nursing and even non-nursing platforms that need help.
Hmm.
Volunteer, be out there. Like me and my family, we volunteer, we for Feed the Children. We do that every month. So it's just you got to get out there and actually assist and help so you understand what's going on and why people are doing things. But it's like a combination of all that will help you reinforce your knowledge base, because unfortunately mainstream media is not it. It's not it. You're not going to get it there. It's a lot of the work you have to do it yourself. So yeah.
Yeah. Well, I do want to piggyback off of that. Like you said, you have to do the work, you have to do the research. There are so many times that I have listened to something and done the research, and whatever they were saying was not true.
Right, right.
Or they will put it right in your face. I remember researching this episode that someone put out, and they read a piece of the article, the
Hmm.
journal entry, and they completely butchered it. It said that it said this, and I'm like, I'm looking at the screen and I'm reading this, and as someone who has done research for a living, I'm like, this is not what it says, and people are using this as a trusted source. And
Mm,
it's so sad when people will utilize their platforms to spread misinformation to people
correct.
when they know that they're just auditory, like they're listening to you, but they're not
Correct.
actually looking at what you're putting on the screen.
Correct. And I think that's so important. I know even for me, I triple check myself because
Mhm.
also we have to remember people are human, right? Yes, mistakes will happen, but if you're grossly
Yes.
putting forth misinformation, that's a whole different scenario. But there's a couple of times I had to retract a story because I made an error on like similar named hospitals. That's a big one. Like there's so many hospitals that are named the same exact thing.
Yeah.
But if I made a mistake on a city or a state, that's a big, you don't want to slander or misalign information with the wrong facility, as an example. So there's a couple of times I even had to retract stories myself because I'm like, wait a minute, and someone called me out on it. Like one of my comments said, "Can you double check which hospital you're talking about?" And when I double checked, I was like, "Oh my god, I said the wrong hospital," and I had to retract the whole thing.
Yes.
And and again, yes, people are human. That will happen. But to your point, yes, there's so much gross information, and people are just purposely doing it just to get clicks and likes. The clicks and likes for me are not important. It's is the information accurate that I'm giving you?
Hmm.
And is it what you need? Like, is this something that will benefit you? Other than that, if you're just doing it for clicks and likes, and then because what you can say can harm someone, and
Yes.
I think people forget that part. People, especially people that are loners or they're hanger-ons to people that are on social media, um, They will eat every single word you say. They will
Yes.
do anything you say. And that's power. That's humongous power that people will take advantage of and twist. And you have to be careful of what you say and how you say it, because that could be someone's life. Um, Even how I respond to people, I try my best to stay professional. There's sometimes I have to kind of get in the gutter with a couple of people and put them in their place. But for the most part, you want to be professional and respectful towards people, because you just don't know what they're going through. And they're actually listening to your words to get them through their day. So I take that kind of power and responsibility very seriously. And I think more people should. If you are going to have a platform, you should be responsible for it, and responsible in what you're saying towards people. So yeah, I definitely um, agree that people have lost the art of research and fact checking themselves and understanding what they're fact checking. Like, don't argue just to argue. Is your argument plausible? Like, does
Yes.
that make sense? So yeah.
I think that we are nearing the end of this episode. You answered all the questions that I have. I didn't even have to answer. I didn't even have to ask them. I'm over here just like checking them off, like, oh, we already talked about that and that and
Okay. Well,
but
that means you're an excellent interviewer. So that means you did exactly what you needed to do. So
and
that's
you're an
good.
excellent interviewee.
I
Okay.
appreciate you.
So what advice would you give to the nurses who are coming up or nurses who are already in the field who are listening to this and they're like, oh, you know what? Legal nurse consulting or executive healthcare administrative nurse consulting is something that I want to do. What advice would you give to them?
I think for our nurses, even if they're new or our veterans, above anything, love what you do. If
Mm-hmm.
you do not love what you do, and it's becoming a feeling of regret, then you need to reevaluate your career.
Mm-hmm.
And don't wait till it's year 20 to do it. And so I just think people, we tend to just get settled, like we were talking before. You
Mm-hmm.
get so settled into that position, that role. Um, and I say, you have to want to love to do it, because your patients feel it. Your patients feel it. The physicians that you work with feel it. They feel energy, right? And I'm a big proponent of energy. And um, you cannot treat anyone to health if you're not healthy yourself. So I think at the end of the day, nursing is not for everyone. I'm going to say that that's going to be the hill that I die on. It is not for everyone, but for those who are blessed to actually be in this profession and be excellent in it, just continue your growth, your internal growth. You do not have to be an administrator. You do not have to be in charge to make a change. But I
Mm-hmm.
also believe that you should take care of yourself. And so I think if more nurses took care of themselves, actually analyze, is this the role for me? Is this the job for me? Is this the career that I want to pursue? I think we would have a lot more happier nurses, and it would be a lot better climate. I think we just have so many nurses that are burnt out. They are just miserable. They're just not happy. And why stay there? And then now you're making the entire environment miserable. I just don't think
Yes.
that doesn't help anyone. And I
Mm-hmm.
think we've lost that part. So I think that would be my advice, regardless of the specialty you're in, whatever you choose to do with it. I am a big proponent of education. So always stay on top of what's going on in policy, healthcare, education, your license, your scope of
Mm-hmm.
practice, laws that have impacted us. Always stay on top of that. But I say, first and above all, take care of yourself. Take care of yourself.
Yes. Because your mental health, pouring from an empty cup is not something you can do.
No,
Zero, zero from
no.
zero is always going to be zero.
It's always going to be zero.
Always going to be
To
zero.
right, yeah, right. So
So
that would
where
be my advice.
exactly? And I would also say, because most people haven't heard this before, I was talking to my therapist and she said, you can't pour from an empty cup. The only way that you can give to others is if you have an overflow. So if you
Exactly.
have a bottle and you're pouring into it and you can't pour anything out, You can't do anything with that. But unless you are pouring into it and whatever is overflowing is what you can give to others.
Correct.
So in this climate, if you can't give, then you cannot give.
Absolutely.
It is imperative, especially at work. At
Yep.
work, you give your kindness, you give your care, but aside from that, all the other energy that can be released into those
True.
ethers, you keep that for yourself because that's all you have. The little
That's
bit of light
correct.
that you have, you got to keep it because you got to keep that little train going.
That is correct. And I always say, take that PTO. Do
Take
not
it.
bank it. Take it
Prepare the
immediately.
prepare the others because I'm not gonna be there.
Prepare the others.
I
Exactly.
I have been the nurse who has been here all the time, every day, on time, and that does not
Mm-mm. Doesn't
get you
work.
anywhere.
Doesn't
What it does,
work.
people will abuse that. As
Yep.
soon as you say yes of something that they want you to pick up somebody else's shift, they might start putting you on the schedule in that
Correct.
other person's place without talking to you.
Wow. Yeah, see, that's what you don't want. Yeah.
Prepare the others.
Prepare the others. So that would be my biggest advice. Take care of yourself, take the PTO. That's it.
Take care of yourself and take that PTO. Where can
That's
they
right.
find you out?
That's funny. That's funny.
And where
So,
can they find you?
oh wow. So yes, I am everywhere. No, I'm just kidding. So
Right.
I am on I am on LinkedIn. I'm on Instagram, Facebook, and TikTok, as well as YouTube, under the same handle at CGN Legal Nurse. For my legal nurse consulting actual work for serious inquiries, we do have a website. It's sunincorp.net. So SUNINCORP.net. That's my actual business website. But again, I try to cross post. When I post a video, I do post on all the platforms just because there's different audiences per platform. Believe it or not, it's different demographics. Like Facebook has more of the 65 plus age bracket as compared to Instagram and TikTok, which are more of the younger demographic. So yeah, so definitely you can find me, and I'm easily reachable. I tell anyone, if you direct message me, it may take a day or two, just 'cause I do get a lot of DMs, I do get a lot of messages, and try to filter through the bots, but I will answer you as soon as I can. So yeah.
Well, I would really like to say thank you so much for coming on to this podcast. You did
Thank
not have
you.
to come on here, but you did.
No,
And
I thank you so much for asking me. I actually love podcasts and I love interviews, and I love that nurses get to actually come together for the right causes and
mhm,
actually discuss things that matter. And
mhm.
this stuff is important, and I think people need to hear what we have to say. So thank you so much.
You are welcome. Well, thank you all for listening. I hope you've made it to the end. If you have any questions, make sure you put them down in the description, as well as make sure you go and you follow her because her content is definitely something that you should be looking at, informed with, and making sure that, even though you may not see it every day mainstream, coming over to her platform, there are things that they aren't telling you mainstream. So make sure that you are informed, make sure that you're going out to the polls and voting, make sure that you're staying well versed in policy and procedures and law policy overall, especially because we don't think that it affects us in healthcare, but it has been affecting us in healthcare. So I
Yes.
want to say that, and I hope you all have a great night, have a great week, and have a great Thanksgiving. I know that it's hard times. So if you are fortunate enough to give back, find organizations to give back to, or find people within your family dynamic in your community who also needs help. I will be volunteering on November 22nd. I will drop that information in the chat, as well as the places that I will be donating to during this season, because we have to recognize that it's not only Thanksgiving, but it's also these kids are out of school. Okay, the kids are not in school, and sometimes the lunch food is the only food that they get. But we want to make sure that people are being taken care of. So I will drop all of that information down in the chat for you. With that being said, I hope you have a great day and bye.